Welcome to the Quick Medical Review Podcast, your go-to resource for reviewing important medical topics. In today's episode, we will discuss Hashimoto's thyroiditis, a commonly encountered condition in clinical practice. This episode will provide a comprehensive overview of the pathophysiology, clinical presentation, diagnostic approach, and management strategies for Hashimoto's thyroiditis. Let's start by understanding the pathophysiology of Hashimoto's thyroiditis. It is an autoimmune disorder where the body's immune system mistakenly targets the thyroid gland. Antibodies, such as thyroid peroxidase antibodies and thyroglobulin antibodies, play a central role in this autoimmune process. Over time, these antibodies lead to chronic inflammation and destruction of thyroid cells, resulting in impaired thyroid function and hypothyroidism. Moving on to the clinical presentation of Hashimoto's thyroiditis, the most common symptoms include fatigue, weight gain, cold intolerance, dry skin, constipation, and depression. Patients may also experience menstrual irregularities in females, muscle aches, and an enlarged thyroid gland called a goiter. To diagnose Hashimoto's thyroiditis, a thorough medical history and physical examination are crucial. Pay attention to symptoms and signs of hypothyroidism as well as the presence of a goiter. Laboratory tests play a vital role in confirming the diagnosis. Measure serum levels of thyroid-stimulating hormone, free thyroxine, and free triiodothyronine. Additionally, antibody testing for thyroid peroxidase antibodies and thyroglobulin antibodies helps establish the autoimmune nature of the disease. A thyroid ultrasound may be performed to assess the gland structure and detect the presence of a goiter. Now, let's talk about the management of Hashimoto's thyroiditis. The primary treatment approach involves levothyroxine therapy for treating hypothyroidism or subclinical hypothyroidism. The dosage is adjusted based on clinical presentation and thyroid function test results, with regular monitoring of TSH levels. It is crucial to educate patients about the chronic nature of the disease and the importance of lifelong medication adherence. Regular follow-up visits are necessary to monitor symptoms, adjust medication dosages, and assess thyroid function. To summarize, Hashimoto's thyroiditis is an autoimmune disorder characterized by chronic inflammation of the thyroid gland. This can lead to hypothyroidism. Thank you for joining us in this episode of the Quick Medical Review Podcast. We hope this review has been helpful in consolidating your knowledge on Hashimoto's thyroiditis. If you enjoyed this episode and found it valuable, please consider subscribing to our channel. Don't forget to like this video and share it with your colleagues and friends who may benefit from this information. Your support helps us continue creating educational content. Stay tuned for more episodes covering important medical topics.